What industrial origins led to CFTR airway clearance vests? Imagine a time when manual chest physiotherapy was the main way to help people with cystic fibrosis clear thick mucus from their lungs. It was effective but often tiring and hard to do regularly. In the 1980s, researchers at the University of Minnesota looked for a better way. They wanted a mechanical device that could do the job more consistently and with less effort. Their goal was to create a device that could help patients, especially children and those with severe lung issues, breathe easier without needing someone to do manual therapy. This effort led to the development of high-frequency chest wall oscillation technology. The idea was simple but innovative: a vest connected to a compressor that rhythmically inflates and deflates. These movements produce high-frequency vibrations on the chest wall. The vibrations help loosen and thin the sticky, thick mucus that builds up in the lungs of people with cystic fibrosis. Once the mucus is loosened, coughing becomes more effective at clearing it out. Because the vest does the work passively, patients don't have to exert much effort, making it easier to stick with regular therapy. The first versions of these vests were created by Warren Warwick, a pediatrician with expertise in cystic fibrosis, and Leland Hansen, a scientist at the university. They licensed the technology to a company called American Biosystems in 1988. Over the years, the device was improved to be more portable, quieter, and easier to use. Changes in the design made it more comfortable and accessible for home use, which was a big step forward. By the early 2000s, these vests became well known in the cystic fibrosis community as a reliable way to help clear the lungs daily. The industrial roots of these devices show how collaboration between medical researchers and engineering companies can lead to real improvements in patient care. The goal was to create a device that could deliver consistent, effective therapy outside of hospitals, giving patients more independence and better lung health. The development was driven by the need to improve quality of life and reduce lung infections, which are common in cystic fibrosis. In summary, the origins of CFTR airway clearance vests come from a desire to replace manual therapy with a mechanical, standardized solution. It started with research at the University of Minnesota focused on high-frequency vibrations, then moved into collaboration with industry partners to turn that research into a practical device. Over time, design improvements made these vests more portable and user-friendly, helping many people with cystic fibrosis manage their lung health at home. Today, they are a key part of airway clearance treatment, working alongside other oscillating devices and physiotherapy techniques to keep lungs clear and healthy. These vests are a perfect example of how industrial innovation can translate into better medical care, improving lives every day.